Africa's National Institute for Communicable Diseases on Wednesday reported 10,017 new COVID-19 cases. The first day since January, the institute has reported more than 10,000 new infections. Gauteng leads with nearly 39% of those infections reported in the province. But even more concerning is the rise in the positivity rate. Joining us now for the view from the NICD on the issue is Executive Director Professor Adrian Puren. Prof, good evening and thank you very much for your time and joining us tonight. The continued or sustained increase in infections driven by and large, I believe, by reinfections. What does that mean, and is that something that we should be concerned about?
Well, I think reinfections are certainly contributing, but whether it's really the major contributor, I'm not sure that we can really say that until we've analyzed the data fully. But yes, the main effect is that we are certainly seeing a marked increase in cases over the last few weeks, but the testing patterns are really different. In fact, the levels of testing have been substantially lower compared to previous resurgences, and therefore we're seeing the very high positivity rates. I think the data from Wednesday is the first time that I've really seen a really marked change in the numbers that are testing. So I think the testing patterns are certainly influencing what we're seeing, so I think we need to be cautious about the trends, but the trends are certainly upwards. Whether they're primarily due to reinfections, I'm not sure that one could say that, but it's certainly a major contributor, certainly.
Previously, when we looked at 10,000 cases, it would have been a cause for concern because of the pressure that the health system would have been experiencing. Is that the case right now?
Yes, so similar to what we saw in the resurgence that we just seen previously with Omicron. Omicron is still the dominant. However, I think we are still not seeing marked changes with regard to hospitalizations and death. So we're still seeing the term that we used was the so-called uncoupling. So in other words, we're having these large numbers of cases that we're observing with mild to moderate infections. However, in terms of the hospitalizations, when we look at the situation with regard to the hospital bed situation and high care, ICU and oxygen utilization, there does not seem to be a major pressure on that at this particular time. But I think it's important, though, to monitor the situation.
Yeah. The complex mix of immunity acquired through vaccines and infection and previous variants and so on and so forth, how does that complicate, I suppose, our response, but also is it helpful in any way?
No, it is important to understand what has happened previously. So I think we've got some recent publications coming out from South Africa showing again that there is a level of protection, especially if you're vaccinated. There's certainly a decline in responses. So we do expect to see greater symptomatic infections. However, it's likely that the T-cell responses, as in the previous resurgence, will still be retained, and therefore we are seeing the uncoupling. So it is important because, again, when you look at the drop of protection against individuals who are not vaccinated, it's very different. So I think it just brings us to the point around further efforts that we should be focusing on. It's not just simply the non-pharmaceutical interventions such as wearing of gloves, small groups, ventilation. These are still critical, but I think that needs to be in combination with greater vaccine efforts to really get people vaccinated. I think that's the critical part here.
Yeah. Everybody, I suppose, question top of mind is, are we in a fifth wave? And what will tell us if we are in a fifth wave or not?
Yeah, so our narrative currently, and I leave that to the Department of Health to comment on, but our current narrative really is just to say that we are in a resurgence, that we should be monitoring. It's complicated by the fact that I said our testing patterns are different compared to previous resurgences. So I think we just need to, I think what is key here is to say, yes, we are looking at the tracking of cases. It's informative to a certain extent, but I think the main focus really for us currently is around what's actually happening at our hospitals and in terms of mortality as well. And of course, we're also looking at other key markers such as our wastewater surveillance. We've just recently released a dashboard for that, and to give us another indicator of what's actually happening with transmission. And again, it's a useful indicator to triangulate with other indicators such as the rates of testing and positivity, and as well as our hospitalizations.
Yeah. Understanding those kinds of patterns, and when we speak of a positivity rate that is rising, sitting at a 25%, Is that something that's alarming when you look at it?
I think it just tells you that there's large rates of transmission. But again, as I said, my concern is that we're not testing to the extent that we've usually been testing. And that maybe is not unusual to see that happening. People are probably ill, experiencing these particular symptoms, flu-like symptoms, for example. They've decided that it's likely Omicron or flu, it's most likely Omicron, that they're not going to test and therefore are isolating, for example. So yes, it is of concern that we're seeing these large numbers and that it will reflect on our hospital systems, but maybe not to the extent that we should be concerned at this time.
Yeah. Is this change in pattern potentially dangerous in as far as testing is concerned? Because the WHO was reporting that the lack of COVID testing leaves researchers blind to the evolution patterns of this virus.
Yeah, so I think with the current circulation of Omicron, I think we really are fortunate in the sense that we have this uncoupling. So I understand the rationale for increased testing and that people should be encouraged to testing. In fact, there's also great effort, I think, in South Africa to try and focus on self-testing as well. So, but even there, where you have self-testing, whether or not you'll get those results to tell you what is the nature and the extent of cases, I think is really going to be difficult. So the point is taken. I think as epidemiologists, we'd love to see more and more testing to really get a good sense of what the numbers are in terms of our planning. That really is important. But I think the patterns have changed, and therefore I think we really need to be ensure that we have some interpolation of what we think is happening with regard to the numbers of cases and plan accordingly.
Yeah. So, I mean, as far as we're concerned, our government has not stopped looking at cases. I mean, I believe governments in other places have completely stopped. They are finding that, I suppose, ignorance is bliss. That's not the case in this country.
No, I think it's still critical for us. You don't want people to become ill. Again, the high-risk groups, especially specific age groups, those individuals with comorbidities, such as diabetes, hypertension, cardiac disease, the immune-deficient individuals, we're still concerned about those individuals, but you don't really want them to end up in hospital. So I think it's still critical that people do take care of themselves, they do get vaccinated, and I think, and get tested where appropriate. Yes.